Hi, my name is Jennifer Pierre. I'm a nurse practitioner student at Maryville University. This is my ID. Okay, before we start, we're going to do a 360 of the room. So today I'm going to be doing my head to toe assessment. This is my patient. Okay, what I'm gonna start out with before I do my head to toe is make sure that my patient has emptied his bladder before the assessment to make sure we don't have any interruptions in the assessment. We've done his height and weight already. We're also going to do his vitals. Okay, so we're going to check the patient's blood pressure. Okay, and just need to arm there. All right. Okay. Patient's blood pressure is within normal limits. Okay. 102/60. Okay, which is very good. All right, we're just going to check the patient's pulse. All right, good. The patient's pulse is about 55. And we're just going to assess his temperature, which is 96.9. All right, and just looking at the pulse again. Okay, and respiratory rate is about 18. So all that is good. So what we're going to go into now is looking at the patient's skull, the symmetry of the ears, the eyes, and just the skull in general. I'm just going to palpate around the skull and assessing for any nodules, palpate around the front of the skull, assessing for any nodules there in the front of the skull. Okay, I'm going to have the patient puff out your cheeks. And we're looking for symmetry in the facial nerves, cranial nerve number 7. And then smile for me. Okay, and frown. Okay, and I'm gonna palpate your temporomandibular joint here. Just clench your teeth and just assessing for muscle tone there. Okay, very good. We're also gonna assess the frontal sinus and the maxillary sinuses for any tenderness or swelling, ethmoid and sphenoid sinus for any tenderness and swelling, which I don't feel there. Okay, and your just while we're here, we're gonna assess for the muscle tone in the head. I'm gonna have you turn your head to the side, not turn your head to the side, bend your head to the side, and then touch your ear to your other shoulder. Okay, touch your chin to your chest. Bring your head back. Okay, good. All right, now I'm gonna have you touch your ear to your shoulder here against my hand. Okay, and push against my hand on this side. Okay, very good. And we're just checking for strength in your neck. The next thing we're going to do is assess the eyes for symmetry. You can look at me and assess for the pupils, making sure that they're assessing that they're symmetrical. I'm going to assess the periorbital area for edema. Okay, the lacrimal apparatus. Okay, and that looks good. All right, and next thing I'm going to do is assess for the patient's pupillary response to light. I'm going to assess for accommodation as well as consensual response. Just look straight ahead for me. Okay, very good. And look straight ahead. Okay, very good. All right. The next thing that we're going to do for the eyes is look at your light reflex, your red reflex, I'm sorry. Okay, your next eye. Okay, then we're going to go in and we're going to just go straight in and look at that optic disc. Okay, that looks good. The venous pattern is moving away from the optic disc, which is what we want to see. Okay, very good. Excellent. Okay, his optic disc looks great. Okay. The next thing that we're gonna do for the eyes, we're gonna assess the cranial nerves number 3, 4, and 6, and the extraocular eye movements. Okay, and here we're assessing for any type of astigmatism. So I'm gonna have you look at my pen and follow the pen just with your eyes and not your head. Okay?
Yes.
Okay. Okay, very good. Okay, so that's it for the eyes. We're gonna move on to the ears. I'm just assessing the ears for symmetry, and I'm gonna palpate the auricle of the ear for any nodules or any tenderness, and I don't feel any tenderness or nodules on the auricles of the ear. The next thing I'm gonna do is assess for hearing with the ear. I'm gonna do a couple of tests. The first test is gonna be the whisper test. I'm gonna have the patient occlude his right ear. Okay, and I'm just going to whisper some letters or numbers, and I just need you to repeat after me. 10,
10,
15,
15,
100.
100,
Occlude the next ear, your left ear. 17,
17,
red,
red,
yellow.
yellow.
Okay, the next test I'm going to do is called the Weber test, and this is going to check for bone conduction. I'm going to put the tuning fork on your head, and you let me know if you hear it in both ears or one ear. Okay, so the patient hears it in one ear, probably going to refer him to just see an audiologist, and we're also going to do the Rene test to check for bone and ear conduction. Okay, and just let me know when you stop hearing that.
Stop. Stop.
Okay. And do the other ear.
Stop. Stop.
And what the Rene tested is normal for the air conduction to be longer than the bone conduction. The next thing I'm going to assess for this patient for the ears is I'm going to take a look at his tympanic membrane with the otoscope. Okay. You can come over here so you can. All right, so I'm going to pull the auricle back a little bit. Yeah. Up and out. And we're going to take a look. Alright, and the tympanic membrane here is nice and pearly gray. I do see the cone of light, it's visible. It's just earwax obscuring some of the landmarks. I do see the handle of malleus there. Okay, very good. And we're going to take a look at the next ear. I'm going to pull back that auricle again. And take a look here. Okay, and good. The tympanic membrane looks nice and pearly gray here. I don't see any perforations or anything like that or redness. Cone of light is present. Again, just some earwax obscuring some of those landmarks, but I do see the handle of malleus there. Okay, very good. Okay. So the ears look good. We're going to move over to the mouth and just assessing the lips for any pallor, which could be a sign of central cyanosis. I need you to open your mouth. Say ah. Okay, and I see the uvula is present, the anterior posterior pillars are present. I don't see any swelling there. The hard and soft palates look good. The oral mucosa looks good. Teeth, let me see your teeth too. I don't see any signs of infection or inflammation on the gums or anything like that for the teeth. No breath odor or anything of that nature, which could be indicative of a whole bunch of disease processes like diabetes. The tongue looks good. I'm going to have you stick your tongue out and move it from side to side, just checking the cranial nerve. Very good. And I'm also going to assess cranial nerve number 10, which is the gag reflex. Okay. And I'm just going to have you say ah, just choke a little bit. Okay, good. So the gag reflex is intact. That's cranial nerve number 10, the vagus nerve. We're gonna move on over to the neck. Okay, of the patient, and we're just gonna assess the neck for symmetry. Looks like the trachea is midline. We're gonna palpate for carotid pulses. And I'm gonna palpate for midline of the trachea. I'm gonna have you swallow. Okay, and then just movement of that thyroid. The thyroid does not feel swollen or anything like that, and that's normal. We don't want it to feel swollen or anything. We're also going to go in and palpate for the lymph nodes, the occipital nodes, the posterior nodes, the preauricular lymph nodes. Okay, the posterior cervical chain, the superficial cervical chain, and the deep cervical chain. Okay, and while we're down here, we'll take a look at those supraclavicular nodes. I don't feel any swollen nodes. Okay, submandibular nodes, submental nodes, tonsillar nodes. Okay, and I don't feel any swelling of the nodes or anything of that nature there. Next, I'm going to go over and take a look at his upper extremities. I'm going to have you put your arms out. It looks like there's no, just looking at the skin, and there's no discolorations. Push your arm up and down against me. Okay, and just checking for muscle strength and symmetry. Squeeze my hands. Okay, good symmetry. Good. And just relax. I'm going to assess for the radial pulses. Okay, and then the brachial pulse. Stop moving, Chris. Okay, good. So those feel good. And next thing I'm going to do is look at your posterior chest wall. So if you can turn around this way for me, okay? So the posterior chest, what I'm looking for also is his AP diameter, comparing it to the lateral diameter. I don't want that AP diameter to be greater than the lateral diameter because that could be indicative of a lot of disease processes such as emphysema. I'm also going to assess tactile fremitus. 99? Okay, and then also excursion. So take a deep breath for me. Okay, good. All right, and then we're also going to percuss since we're back here for diaphragmatic excursion. Okay, I got my little pieces of tape here. If I can get it off the bed. All right, so I'm going to have you take a couple of deep breaths, and I'm going to have you deep breathe all the way out and hold it. Good. Okay. All right, now take a couple of deep breaths and breathe in and hold it. Take a deep breath in and hold it. Okay, good. Okay, good. All right, so that looks like it's probably about maybe 3 centimeters or something, but it should be normally between 3 and 5 centimeters here. Okay. All right, so that's about 4, which is perfect. Okay. All right, and that's the diaphragmatic excursion. While I'm back here, I'm also going to go ahead and percuss his lung area. Just comparing each side. You can breathe normally too. All right, and lift this arm up. I'm just going to percuss the lateral area. All right, good. You can turn back around for me. Okay, very good. And we're going to go ahead and percuss the front of the chest here. All right, and like I said, when I was checking at the AP and the lateral diameter and comparing those, I was also assessing the patient's respiratory effort, making sure that he's not, assuring that he's not using any accessory muscles or any nasal flaring going on. And also, like I said earlier, his lip color, making sure that there's no cyanosis there. I'm going to go ahead and then assess the cardiovascular system. I'm going to assess his precordium, okay, and palpate at the apex. Around here. Oh, well, around this way so they can see. Okay, the apex. Okay, and I'm just checking for any heaves or lifts. And again, at the left sternal border, heaves and lifts, and at the base. And I'm just assessing for any heaves or lifts there. Okay. I'm gonna auscultate the cardiovascular area. The second intercostal space, right sternal border, is the aortic area. Left sternal border, second intercostal space, pulmonic area. Second intercostal space, tricuspid. The third intercostal space is the second tricuspid, or what they call the Erb's point. Fifth intercostal space, midclavicular line, is the mitral valve area. Okay, and those all sound good. I'm just gonna also auscultate the carotid pulse. Now I'm just checking for any bruits, and then also that thyroid for any bruits. There. Okay, I'm gonna have you lay down on the bed, and we're gonna assess the abdominal area here. Now with the abdominal area, while the patient's laying down, the first thing I'm gonna assess is assessing for any venous patterns, any nodules that are protruding. I'm gonna have him lift his head up a little bit off the bed and assess to see if there's any muscle separation. You can relax abdominal muscle separation, or if there was any hernias that have shown themselves. I didn't see anything like that. Next, I'm going to auscultate all four quadrants. And just assessing for any bowel sounds. Okay, I'm going to assess the aorta. Okay, the renal arteries. And the iliac arteries. The femoral arteries. Okay, good. And it sounds good there. No bruits or anything noted. The next thing I'm going to do is percuss the abdomen. And I'm gonna percuss that gas, the gastric bubble there, air bubble. I'm gonna also percuss for the liver border. Okay, good. And percuss for splenic dullness. And I'm gonna next do some light palpation, and here I'm just checking to see if the patient's having any tenderness too before I go into deep palpation. Then deep palpation here, okay, checking for any nodules or anything like that, and then of course deep palpation around the umbilical ring. I'm gonna palpate the aorta for any pulsations or anything. Palpate for the kidneys. The kidneys should not ordinarily be palpable, but I'm gonna palpate that. So I should not ordinarily feel those. Palpate for the liver border. Okay. And then the spleen on the left here. Okay. Don't feel anything there. Next I'm going to move down to the legs, and I'm just assessing for any, just looking at the hair distribution on the legs, and we're going to palpate for any edema, which could be a sign of DVT. I don't see that, and there's no discoloration or anything in the skin that would be abnormal, except for just some bruising. Checking for dorsalis pedis pulse. Okay, popliteal. Okay, and then the Achilles. Okay, very good. And we're going to sit back in the chair. So while the patient's moving over to the chair, the next thing that we're going to do is the sensation. And that's just what testing cranial nerves. So we're going to test sharp and soft sensations. So just let me know where you feel this and if it's sharp or soft. Okay, close your eyes for me.
Arm sharp. Arm sharp. Chest sharp. Chest sharp. Cheek soft. Cheek sharp. Head sharp.
Okay, very good. And it looks like all of those are good. No problems with his cranial nerves in that sense. The next thing I'm going to have the patient do is we're going to look at deep tendon reflexes. And okay, so we're going to look at the brachial. So I'm just going to need you to bring your arm up a little bit. Okay, and then relax. Relax. Okay. Okay, good. And make sure those reflexes are good. Okay, thank you. Bring your arm up a little bit and then relax. Good. Okay. So the next thing we're going to do, come on this side because I'm a lefty.
Okay.
And we're going to just check this one right here. And the Achilles. Good. Good. All right. And the next thing that we're gonna do is actually have you stand up. Okay, and I'm gonna have you bend over. Okay, and I'm just gonna assess the spine for any nodules, any tenderness in the spine. And I don't feel anything else. If you can just stand up, push your head forward a little bit. And I'm just gonna check this vertebral landmarks, C7 and T1, and they're intact and midline. You can sit down. All right, and I'm just gonna check your feet. Push your feet up for me. Okay, and then down. Okay, very good. Pick your legs up and then push them down for me. Okay, good. Muscle strength. All right, and that's the end of my head to toe assessment. Thank you.